Hello, I'm Union County Commissioner Chairman Al Mirabella. On behalf of the entire Commissioner Board, I want to thank you for joining us today. We are proud to sponsor this event, which is just one piece of a larger commitment to combating domestic violence. Special thanks to our County Prosecutor Lindsay Rotolo, the YWCA of Union County, the Family Justice Center, and the New Jersey State Bar Foundation for all your work to make today happen. The pandemic has reshaped our world as we know it, but underneath the existing dangers, there exists what the United Nations has begun referring to as a shadow pandemic, a related spike in domestic and sexual violence. Before COVID, 1 in 3 women and 1 in 5 men globally experienced physical or sexual violence by an intimate partner. Now, even though the data is still being collected, we know that many countries have unfortunately reported increases in that violence. The United States National Commission on COVID-19 and Criminal Justice reported an 8.1% increase in incidents, and that surge is just one of many. The harrowing piece of information underscores the critical work that Union County does to support domestic violence survivors and makes our mission more urgent than ever before. This year, we relaunched our Rape Crisis Center so virtually victims can have quick, on-demand counseling services and so that they understand their options. The Rape Crisis Center has been aiding survivors since 1985, providing services completely free of charge. Through the prosecutor's office, our domestic violence unit continues to pursue violations of restraining orders, child custody orders, pursue parental abductions, and participate daily in virtual court appearances. Additionally, the Commissioner Board sponsorship of our County Family Justice Center, Office for Victim and Witness Advocacy, and the local YWCA remains unwavering in this trying time. We are grateful for all the work that they do to protect our vulnerable. We will always do our part to combat domestic violence, and I'm confident knowing that we have so many great partners to help us in this mission that will be successful. Thank you.
Good afternoon, and thank you for joining us today. My name is Lindsay Rotolo, and I have the honor of serving as the Acting Prosecutor of Union County. I would like to begin today by thanking our partners at the YWCA. I would also like to extend a thank you to the New Jersey State Bar Association for its sponsorship of this event, and a special thank you to the Union County Board of Commissioners for their support of the important work of our office, especially in the area of reducing domestic violence in our community. For 7 years, the Prosecutor's Office and the YWCA have joined forces to host an annual symposium on domestic violence issue of significance to our local community. Our symposium aims to bring survivor service providers, healthcare workers, and law enforcement officers together to discuss ways to address and combat domestic violence in our community. This year's symposium, our first to be held virtually, comes on the heels of an incredibly challenging year. We have all felt the enormous impact of COVID-19 through the loss of loved ones, the loss of our health, the loss of financial stability, and the loss of a sense of community. Just as it has with so many other aspects of our lives, the pandemic has reshaped how victim advocates, healthcare heroes, and first responders support domestic violence survivors. From retraining officers on DV protocol during the pandemic, to arming advocates and doctors with PPE for themselves and for victims to ensure health and safety is maintained during the difficult moments following an incident, to reshaping the justice system and moving court appearances to virtual platforms. COVID-19 has forced our community to rethink how we handle incidents of domestic violence. But through the chaos and uncertainty of the past year, our work has persevered. Officers across the county continued to respond and render aid in calls for domestic violence. Assistant prosecutors never lost sight of the pursuit of justice for survivors. Victim advocates carried on in their work supporting survivors. Healthcare workers tackled unprecedented challenges with compassion. And all along, our dedication to victims and survivors never wavered. Today, we will hear firsthand from experts across 3 panels on how COVID-19 has impacted their work to support domestic violence survivors throughout the pandemic. Panelists and attendees, thank you. Thank you for dedicating time to join us in this important community conversation. Your participation is a testament to the support Union County strives to provide to each and every survivor.
Good afternoon. I'm Tina Early, the president of the board of directors at YWCA Union County. The Domestic Violence Symposium is now in its 7th year, addressing important issues related to domestic violence. Each year, our symposium has reached over 250 community members, law enforcement personnel, social workers, counselors, medical providers, faith leaders, and volunteers. Our goal is and has been to educate the community about domestic violence, therefore improving the community response to and understanding of domestic violence. We cannot talk about domestic violence in this time without talking about COVID-19. We all know that the pandemic has had an enormous impact on victims of domestic violence, but what does that look like in our communities? Today, we're going to answer those questions. I'd like to thank our partners in putting this program on today, the Union County Prosecutor's Office and the Office of Victim Witness Advocacy. And thank you to all of you participating today in this symposium. Our hope is that you will come away with this useful and actionable information. We encourage you to live tweet during this program using hashtag #UC_C.A.R.E.S to share this important information with your networks. If you want to learn more about the YWCA Union County and our services, visit our website, www.ywcaunioncounty.org, and follow us on social media. I'd like to take a minute to introduce Adela C.A.R.E.S, the YWCA Assistant Director of Core Services. She oversees all direct service programs. She joined the YWCA in August 2017 as the first director of the Union County Family Justice Center. Under Adela's leadership, the Family Justice Center reached over 1,700 survivors and has delivered over 10,000 services, providing critical services to victims of domestic violence. Earlier this year, Adela took on the position of Assistant Executive Director for Core Services and is leading our team of program directors, ensuring high quality programs and services for our community. Thank you very much, and I'll turn it over to Adela.
Thank you so much for that very kind introduction, Tina. Good afternoon, everyone, and thank you for attending this year's virtual Union County C.A.R.E.S Domestic Violence Symposium. My name is Adela C.A.R.E.S, Assistant Executive Director for Core Services at the YWCA of Union County. As our opening speakers mentioned, today's symposium will include 3 panel discussions, each diving into COVID-19's impact on service provision for survivors of domestic violence through the lens of law enforcement, healthcare, and victim services. Prior to today's event, you received 2 important documents via email: a copy of the event program, which invites you to learn more about today's panelists and participating organizations, and a resource guide, which includes a bilingual collection of local organizations that support victims of domestic violence in Union County. For the attendees joining today receiving CEU credits, please make sure to fill out the survey that will pop up at the end of the Zoom webinar. This survey will allow our organizers to finalize these credits. With all that being said, let us begin with our first panel, a discussion on COVID-19's impact on law enforcement and the justice system. Today on the law enforcement panel, we have Teresa Hilton, Supervisor of the Domestic Violence Unit at the Union County Prosecutor's Office, responsible for the prosecution of criminal domestic violence charges, disorderly persons, and restraining order violations. Next, we have Giacomo Sacca, who currently serves as the Chief of Police for the City of Elizabeth. Through his 26-year career as an officer and agency supervisor, he and his unit have responded to thousands of domestic violence calls and have worked closely with the YWCA Union County to support survivors of domestic violence. Welcome.
Thank you.
So the effects of the pandemic have been felt across the board by the criminal justice system, including law enforcement, prosecutorial teams, and the courts. Can you, either of you or both of you, walk the audience through what the initial police response and maybe subsequent investigation and prosecution of an incident of domestic violence, what that would look like? And then maybe just highlight a little bit of what some of the changes have been as a result of COVID.
So I'll begin with the initial response, and then I'll hand it over to AP Hilton for the prosecution end.
Sure.
So as the police, we respond to calls for service, and in domestic violence cases, anybody can call. So it doesn't have to be the victim, a person who's directly involved. It can be a family member who received the call, or a friend who received the call. It could be a neighbor who overheard something. And the police have a duty to investigate. Now, how far the police investigate is always based on the totality of the circumstances. What is happening at the time that they get there? So the initial response will start with a basic investigation. The people will be separated. They'll be interviewed. And then from there, the police will have to make a determination whether a crime occurred. There's a set of standards and laws which the police must follow. In the state of New Jersey, the local police follow the county prosecutor's office and also follow the attorney general's guidelines. So picture it as a pyramid with the attorney general putting the rules at the top and then flowing downward. So based on the laws, the rules that the agency follows, the officers will make a determination whether someone needs assistance. If there's an arrest to be made, a lot of times the police discretion is removed and they have to make mandatory arrests. Then they'll make the arrest, and the person who is the victim will then be offered relief, which can come in the assistance of a restraining order, a temporary restraining order, or medical service care. The police always prioritize the protection of life first, and then the protection of property. The person who's the victim will then be offered transportation to police headquarters, or can come to headquarters on their own. And then from there, at headquarters, we'll take statements, conduct any follow-up to the investigation that we have to, and they'll also be put in contact with a judge who can then grant them emergent relief. The police will finish up their investigation of that part of the case, make sure that the victim is safe, that if they have any dependents, that they're cared for, and then follow up with court, and the prosecutor's office takes over from there.
So when the prosecutor's office receives a case, we review all the information. Sometimes there's a request for additional follow-up on interviews or surveillance video, depending on the nature of the incident. Somebody from the prosecutor's office, victim witness advocacy, will reach out to the victim, provide services, see if there's any specific concerns the victim has in order to be able to proceed with the prosecution or be safe going forward. The victim will also hear from a prosecutor who will discuss possible plea offers so that we can try to resolve the case early. And if it doesn't get resolved early, the victim will be updated on subsequent steps, including presenting to a grand jury. So that's how we get from a complaint warrant to an indictment, is we present the case to the grand jury, and the grand jury votes to indict. And then after the indictment, several things can happen. There will be conferences where we still try to resolve the case. We will always reach out to victims to discuss plea offers to get their input on how the case is resolved. Sometimes there's motions involved. Usually, the victim does not have to be involved until, in the circumstances where it goes to trial, the victim would be necessary to testify. That's often quite a ways after the incident occurs. Occasionally, a victim is required for a motion hearing, but that's very rare. So that's pretty much how it looks right now. In that sense, in terms of how it's changed from before COVID, the process is still very similar. The differences are really, I think, at the beginning stages where a lot of the victims are applying for their restraining orders through the police department. It used to be that victims would go to the family court to apply during business hours, but they've had limited hours. At the beginning of the pandemic, they were closed. So more victims have been applying for those restraining orders, either at police headquarters through the municipal judge, through a hotline that the family court has offered, or through, it has opened at this point, and victims are going to apply for restraining orders now, but not at the same volume that they were before.
Mm-hmm. And the final restraining order hearings are also happening via Zoom as well.
Well, so neither the police nor the prosecutor's office are involved in final restraining order hearings. Those are civil matters, not criminal matters. So I know that there are some criminal matters that are still handled in the family court. So disorderly person contempts are handled at the family court. Those are violations of a restraining order from a domestic violence situation. And the county prosecutor's office handles those cases. And those cases are proceeding by Zoom. So it's my understanding that most of the family court, even the final restraining orders, are happening by Zoom. I believe there are some circumstances where they do it in person, but the majority of it, I believe, is by Zoom. But like I said, law enforcement's not involved in those proceedings.
Right. Okay. So some changes, definitely, as a result of COVID. Along those same lines, in the past year, and maybe this is more for Chief, but have you noticed more, a notable increase really in calls for service, in the cases, and for the applications of the temporary restraining orders?
Yes. So one of the functions that the police do is constantly attempting to reduce crime. So we study our statistics, our numbers, and look for the best places for us to allocate our resources so that our job ultimately is the safety of the city. And when I did a comparative study of the crime rates and the calls for service over the past 3 years, there is a significant uptick in domestic violence, and based on the COVID year. So, for example, if we look at the 2018's calls for service, 161,000 people called the police department for some type of service in 2018. Now, I used the markers between March 15th and March 15th because that was the beginning of COVID, was March of 2020. So from March 15th of 2020 through 2021, we only had 169,000 calls for service. However, the previous year, the same time frame, the previous year, we had 196,000 calls for service. So 26,000 less people called the police during the COVID crisis. And all of our crimes across the board significantly reduced by approximately 25%. The police actually made half the amount of arrests that they did during the COVID year as the year prior. However, domestic violence went up. It went up by 57 cases. So the close proximity of people, the inability to be out caused an increase. What we did see, though, was a decrease in the amount of people that applied for temporary restraining orders. And we don't have any facts as to why. There was no surveys done as to why people were less likely to apply for a restraining order during that year, because in previous years we saw up to 200 more. However, if you think about it and with common sense, generally, COVID caused people to not want to do things even if it was beneficial to them. For example, there was articles that people weren't getting medical care. People weren't going to the dentist or weren't even getting cancer care. I think the same theory can be applied here, is that not that the services weren't available, but that people were more likely to have a greater fear that if they went out, they would contract COVID.
Certainly, certainly. Okay. So, so given, this uptick that you mentioned and just really the volume of call outs that your officers are seeing, what type of training, is provided to new incoming officers, veteran officers, and prosecutorial teams as well, that pertains specifically maybe to addressing domestic violence and recognizing mental health concerns of victims?
So in the police academy, everybody receives a basic training on domestic violence and also dealing with people that are going through an emotional crisis. Under state law, the same laws which say what is a domestic violence and what is not, what you can arrest for and what you cannot, there's mandatory training for police departments. The state law is that all police departments must have 4 hours minimum refresher training. Now, in the Elizabeth Police Department, what we do is we do an online presentation. It's a video supplemented with PowerPoint. There's a test at the end. There's approximately 20 different laws, directives, areas of case law, all which cover domestic violence. Since 1991, the Attorney General has put out a guideline on the rules surrounding domestic violence cases, and they're updated every couple of years. In addition to the mandatory training, this year we also are working with the prosecutor's office to do as best we can a live portion or through a Zoom portion of an interactive victim witness enhancements, how we can provide better services, how we can fully understand all of the resources that are out there so that the officer on the street actually knows where the best places to direct the victims to.
For the prosecutors, all attorneys have yearly training requirements that we have to comply with, and prosecutors generally attend a conference every year, and there's always some blocks of time that discusses victim impact issues, and better ways to handle and prosecute domestic violence incidents.
Okay, that's great.
I'm sorry, if I could just add one other thing.
Sure.
Also, the training not only covers the laws, it also deals with how to deal with people in crisis. In addition to the domestic violence training, we have dealing with people who are emotionally disturbed or under extreme stress. Also, the police receive the same amount of training in recognizing bias, recognizing the implicit bias. We also covered topics such as dealing with transgenders and the LGBTQ community. The law is very clear that sexuality has nothing to do with domestic violence situations. So all of that is covered in the annual training.
Okay, wonderful. So domestic violence not only impacts, the immediate victim, the immediate family, but it also impacts the community at large. A question that came up is, can a witness remain anonymous, if they report an incident of domestic violence to the police, both initially, and through the course of the investigation and prosecution?
So I'll start again, and then I'll hand it over to AP Hilton, because the answer is really yes and no. So the police must investigate every call for service to a logical extent. So a neighbor can call and can remain anonymous, and we will still investigate. The person who wants to simply have anything that they suspect to be violence stopped can tell us, and we will go and based on a totality of the circumstances, follow it through to a logical end. When a police officer has to make an arrest for domestic violence, there is not an in-presence requirement, meaning the officer does not have to see the crime occur. So we can basically take what we have. We can see signs of injury. We can take someone's statements. We can compare the two statements at the scene and make a judgment call. The law says you are allowed to do that. In other cases, we wouldn't be allowed to do that. For example, for a theft case, if we didn't witness the theft and we didn't have evidence on it, we couldn't do it based on someone's word. But in domestic violence, you may take those factors in. So a person can remain anonymous when doing the reporting for our end. However, AP Hilton.
For the prosecution end, if we don't have witnesses to present at trial, we cannot prosecute a case. So if we don't have witnesses to testify to what happened, and sometimes the only witnesses are the ones who reported in the first place, we won't be able to proceed with a prosecution if everybody is anonymous and there's not sufficient independent evidence to prove the case.
So I think this is a perfect segue for the next question. What are some, other, including that unique, inherent challenges, posed by domestic violence investigations and prosecutions?
So for the police, the biggest challenge with a domestic violence case is that you're dealing with family members. You're dealing with people who are involved in relationships. So that and the victims of domestic violence are extremely close to the actual problem. So there are so many ancillary factors that come into this dynamic. There are financial concerns, childcare concerns, family opinion, public opinion. So all of these factors make it difficult because this is not a stranger on stranger crime. And often the victim simply wants the violence to stop and is happy with that, or is in a state of believing that once they're told to stop or once the police intervene, that it won't happen again. So for the police, we often run into the problems of lack of cooperation after we have made the initial determination that someone needs to be arrested. That we do not have the option of simply removing a violator and going about our business. We have to, in certain situations, we must make an arrest. And that becomes difficult when the victim didn't foresee it or really didn't want that to be the outcome.
I would agree with that. The complexity of the emotions involved in these cases, it's greater than other crimes that we deal with. So what we are challenged with is that from the prosecution side, we are trying to take into consideration the safety of the community as a whole. So we're concerned with the victim, the immediate victim of the domestic violence, but we also extend that concern to the children who are witnessing it, or are sometimes the individuals calling 911. We have a lot of 911 calls coming in from children. We also have a situation where we also have we're also concerned with the neighbors and the people who are on the collateral. Collateral is not the best word for this. There's people who are impacted by domestic violence that aren't the immediate victim. Neighbors who hear it happening, who are afraid to report it, or are afraid that those neighbors or their family members could be targeted by the abuser if they say something, has ripple effects throughout the community that you don't often see with other crimes. Not to the same insidious level, because it's something that is hard for law enforcement to prevent without it being reported. So the complexity of the emotions involved, I think, makes for witnesses who sometimes don't want to cooperate with us, sometimes don't want to cooperate with police. Chief Saka didn't mention this, but domestic violence incidents are some of the most dangerous incidents for police officers to respond to, not just because they're at risk from the abuser, but there have been numerous situations where the victim has turned on the police officers who have responded to stop that violence from occurring. So there's also, so not only do we have complex emotions involved, there's confusion often about the role the prosecutor and the police play. We're enforcing the law. So we're not representatives of the victim. We don't represent the victim at restraining order hearings, for example. We're representative of the state. We're trying to enforce the laws of the state so that all those people who are affected by domestic violence outside of the immediate victim are still protected. So that confusion ends up with some people trying to use the criminal process as a sword. A lot of people believing that when they want to reconcile with the defendant, that the case needs to be dismissed, and that's not our role, and that's not how the process works. So emotions and confusion about the process, I think, are some of the biggest challenges to prosecuting these cases.
Okay. So, along those lines, what can police and prosecutors do to ensure that domestic violence offenders face appropriate repercussions for their actions, ensuring that, they don't get away with just, maybe a slap on the wrist, or no repercussions at all?
Well, the laws on domestic violence are stricter than other laws, and what the legislature did was they carved out specific crimes, and they lowered the bar for an arrest, and so domestic violence. So going to the question, how do we ensure that people aren't just getting a slap on the wrist?
Yeah.
You can commit a crime that is not domestic violence related, and the police cannot arrest you. The police can only advise the two parties that you have to sign complaints against each other, and that it's up to you to argue your own case in front of a judge. However, if you take this scenario and you take the exact same crime, which would be normally considered a lower level crime, such as harassment or simple assault, and now under law you can arrest them, and you can arrest them. You can provide emergent relief. You can put them in touch with counseling services. You can put them in touch with relocation, rental assistance. So the prosecution is easier for the police to be able to arrest somebody and put them into a system to lead them to being prosecuted than it was other crimes. So that's how domestic violence perpetrators, that's how we ensure that they're not just getting a slap on the wrist. They can't just commit a bunch of lower level crimes and not have to pay for it.
So, from the prosecution's perspective, what we try to do is be very offender focused in order to make sure that somebody is held accountable. More often than not, what we see is that victims don't want us to proceed, even though serious crimes have occurred. So we take that into consideration, and that can affect, and often does affect the plea offers that are given. But we still have an obligation to enforce the law. So that's why we have, like I said, that we're offender focused. We focus on the offender's criminal history, the evidence we have. Body-worn camera has really been a game changer in terms of how we proceed on domestic violence cases, because so many incidents are caught on body-worn camera very soon after it occurs. So you can see the immediate injuries and the immediate emotional impact, which is compelling evidence. What we do is really focus on looking at all the evidence that we have, not just what the victim tells us, to make a determination on proceeding on a domestic violence case, so that we are holding people accountable for crimes that are committed, even in the circumstances where it's understandably mixed feelings on the part of the victim who is abused by this individual, but also clearly has some love for him or her based on, the times when the abuse isn't happening, I guess.
Sure. Okay.
So if I may add something to
Sure.
that, what AP Hilton described, the changes in prosecution cases and how we go about collecting evidence and how working as a team with the prosecutor's office, we work to ensure that the violators don't repeat the offenses, and how do we ensure that the victims keep safe? It's a holistic approach. It's the training. It's the working with the prosecutor's office. It's the new ways of gathering evidence. The body cameras, taking statements on body cameras. In Elizabeth, we have a victim witness room specifically set up so that we can do teleconference with judges, with the prosecutor's office, so that it's because of COVID, we've been away from in presence, but we do the best we can so that we can leverage the technology. So it's different than being on the phone or reading a report where you can actually see something, get to see the person's emotion, get to understand how the victim actually feels at that time. So all of these things all contribute to the way that we work to make sure that we combat one of the most crimes that we see, which is family violence.
Right. A lot of variables in this very complex work. Okay. Well, I think we have run out of time. I want to thank both of you for your perspectives and again, taking the time to, speak to the audience on this very important area. Thank you both. Have a great day.
You too.
I appreciate it. Thank you. And I just want to appreciate putting this forum together. One of the most important things for us, for the police, is that people say something, people help each other and get help before it turns into a situation where we are mandated to take action. If we can spread this so people have an awareness, so people know that resources are out there before it gets violent, and know that it's not unique to them, that it does occur and there are ways to prevent it. But I just appreciate everyone and just want to say thank you.
So another way that the COVID-19 health crisis has impacted survivors of domestic violence and their children is in the area of healthcare. Changes in operations, access to services, among other ways. So here today, we have two professionals in this field who are going to speak more about this topic. I'd like to introduce first Dr. Jim McCreath and Dr. DeBellis. Welcome.
Thank you. To be here.
Thank you. Jim, would you like to share a little bit about yourself?
Sure. Thank you, Adela. And thank you to those folks that are watching. This is a very important topic. My name, as Adela said, is Jim McCreath. I am the Vice President for the Department of Psychiatry and Behavioral Health and Long-Term Care at Trinitas Regional Medical Center in Elizabeth, New Jersey. I've been in the field of mental health for about 45 years, and I've been at Trinitas for about the past six and a half years. And I love being in Union County, and I'm very happy to participate in today's workshop. Thank you, Adela.
Thank you. And Dr. DeBellis, a little bit about yourself?
Sure. I am a child abuse pediatrician at the Dorothy B. Hirsch Regional Child Protection Center at St. Peter's University Hospital. I've been in the practice of child abuse pediatrics for about 25, 30 years. Oh my God, long time. And I've been the medical director of actually the Northern Regional Diagnostic Center up in Bergen County for 18 years, and then came down to Central New Jersey, where I do evaluations of child physical abuse, sexual abuse, and child neglect.
Okay. Thank you. So let's dive in. Given the state of affairs for now a year plus, can you both tell us about maybe any changes to, your procedures or the services that you have offered, you've been offering to survivors of domestic violence? And further, has there been, any change in terms of training of staff around this area?
Sure. Adela, Trinitas has always responded to domestic violence in families through either our emergency room, where they would be referred to our behavioral health programs, and our adult program if it was an adult, our child outpatient if it was a child. But we've always had those services available. But the issue was always the linkage, getting someone from the ER to actually follow up. We had a wonderful opportunity in 2019, before the pandemic, to apply for a grant which was awarded for Union County for Trinitas to provide services to victims of crimes, victims who were treated in a medical emergency room. That program is, the acronym is TRAC, T-R-A-C. It stands for Trauma Response, Assessment, and Coordination. Now, in 2019, before the pandemic, in looking at the crime statistics, we came to understand that a large proportion of the crime statistics are domestic violence related. So in thinking about that, we reached out to the Y, the Union County Y, to develop a partnership to bring their expertise into the team so that victims who are treated in the emergency room for domestic violence receive immediate contact, immediate warm handoffs to any array of therapists, either within the team or in our traditional outpatient programs, based on that individual's preferences and their needs at the moment. So I'm pleased to say that we have a very specialized team of people who can work with victims who are seen in our emergency room, and they can offer an extraordinary array of services. As for training, Trinitas, like most hospitals, has always identified core training that's done on an annual basis for all employees. Domestic violence was always one of them. So one of the modules that every single employee, housekeeping, clerks, administrative people, clinical people, they all have to take the same module every year to be reminded of the signs and symptoms of domestic violence, as well as what to do should you become aware of a situation. Now, for our outpatient staff, for our behavioral health staff, they obviously have much more sophisticated training within the scope of their licenses, within the scope of their expertise. So our licensed clinicians have much more training in the area of assessment, recognition, treatment planning, and actual treatment. And then further, for the track team, they received, as part of, again, the expectation that a lot of the crime victims we're going to be working with do have domestic violence issues, they all went for much more intensive training in domestic violence. So I think across the board, there's a very strong recognition of domestic violence. And in the ER and in our track program, at least now, we have a very, very intensive program for folks that come into the ER as a result of being victimized in some kind of partner type relationship. Thank you.
At St. Peter's, in terms of training, and most hospitals in the country, really, if they meet JCAHO standards, will have policies and protocols and screening tools to identify domestic violence victims. And yes, same thing as Dr. McCreath said, every year we're required to have ongoing module learning in the area of abuse and neglect, as well as domestic violence. Being a pediatrician, of course, I'm seeing domestic violence in terms of the abuse, child abuse and neglect. Children who are at risk for child abuse and neglect are more likely from family situations where you will see domestic violence. So in essence, the big issue that I face, however, is that the point of contact that I see is either through the emergency room or through the Division of Child Protection and Permanency, both of which, in terms of ER visits as well as the Division of Child Protection and Permanency, the contacts have decreased significantly during COVID. So I think, we all are ready for that potential victim, but we have to reach that victim. And that's the challenge right now, is reaching that victim. It sounds like the mental health community has more of an opportunity to do that. But once that person makes that contact, I think the assistance is there. It's just getting that family in and getting that person, getting an open dialogue with that person.
Sure.
Okay. So given the dynamics of domestic violence, being emotional in nature, psychological, financial, and then the physical aspect of it, can you speak to what the long-term effects, medical and on the mental health side, would be to a victim of domestic violence, and even the effects on the children?
Sure. Well, I can speak to some of that. I think the doctor's expertise is more appropriate for the child abuse part of it. But I can tell you, Adela, that there are extraordinary long-term effects to domestic violence. And this is pre-pandemic. And now with the added stress of the pandemic, and by that I mean potentially longer-term unemployment, financial stress, the isolation of being home for an extended period of time, being out of school, the loss of that structure for the child on a day-to-day basis to know exactly Monday to Friday what's going to happen class by class by class, totally out the window. So we don't know the full scope of this pandemic on top of domestic violence, but we know that it will be long-term in the sense that people will have to process these issues for years to come. It will not end when hopefully we get to herd immunity and we don't see any numbers anymore. No one should think that the psychological trauma of all that has gone on will go away at that time. I think we'll be following this for years, and we'll be looking at issues of somatic concerns, psychological concerns, relationship issues, how people relate to each other after coming out of a domestic violence situation extended through a year and a half, maybe 2 years, through the isolation of the pandemic. We haven't even begun to get our arms around what that's going to look like, but we can expect that it will be extraordinary.
Thank you.
I have to agree with you, Dr. McCreath. You know, in preparation for this panel discussion, I tried to do some research about what the numbers are out there and what the research is telling us so far. Of course, it's limited. Of course, you know, there are, we don't really have a full grasp of what the long-term findings would be, only to say that there have been a decreased number in hotline calls about child abuse and neglect. Clearly, that's because the schools the school professionals who are the individuals that call the hotline the most, obviously, the professionals that have the most contact with kids, you know, on a daily basis, school personnel, followed by law enforcement, followed by mental health, followed by medicine. Okay, so medicine's number 4 down on the list. And then lastly, any relation or family members. This is important because it's the point of contact that allows us to reach in and kind of identify those victims. Our biggest point of contact, the schools, have been eliminated, basically, for the most part. And we know that this is intensifying abuse victims. It's not that they're not out there, they're there. We know this because even though we see a decrease in emergency room visits for child abuse and neglect, and the statistics out there have shown that there's been a 50% decrease in visits to the ER for child abuse and neglect, but we've seen an increase in the number of hospitalizations for severe child abuse and neglect. So the abuse is not only continuing to happen, but it's intensifying in the fact that the injuries that we're seeing are requiring hospitalization. So it's alarming and it's concerning. For sexual abuse, again, decrease in ER visits, but we have seen increases in the number of outreach to organizations that support victims of child sexual abuse and physical abuse. For example, the National Hotline Consortium has seen an increase in outreach by children to their toll-free numbers. Child Help USA has seen a 40% increase in calls from minors. RAIN, the Rape, Abuse, Incest National Network, has seen an increase in calls from minors, and 79% of those calls involve children who are living with their abusers. The National Center for Missing and Exploited Children has seen an increase in the percentage of online enticement from 63% in 2019 to 98% during the pandemic. So our victims are out there, okay? And it's just a matter of now we have to find them differently as professionals. We've seen states report increase in numbers of calls to the police and arrests related to DV. And where you see DV, you will most likely see child abuse and neglect. What we found looking at the research is that in other disasters throughout our nation, hurricanes, earthquakes, the H1N1, infectious disease crisis, those crises that involve quarantine seem to be the types of crises that cause the most impact on both mental health and somatization of that trauma. Because of the quarantine intensifies the crisis and ends up in children who are more severely injured in these cases. And the last thing I actually found is that the issue of quarantine increases PTSD symptoms, which obviously Dr. McCreath can speak better to. The point is that the intensity of the circumstances of this disaster have not only changed the way we need to respond to victims, but has changed the community contacts. They used to be schools. They used to be people, they were a victim of abuse. If they had a bruise or they had a head trauma, they would maybe show up in the emergency room. Now those less significant injuries are not showing up in the emergency room. So are, in my opinion, the major force is mental health, because you continue to be that point of contact where we can identify families who are at risk.
Thank you. Those numbers, those statistics are astonishing. And frankly, I mean, it's very sad to know that there's just such a number of, there's a volume of children, of survivors that we're not reaching.
And our victims are trying to reach out. It sounds like, based upon all these organizations that offer help online, they're trying to reach out. And so we just have to change our approach on how to reach them.
Right. Now, when we do reach them, let's say when they do make contact with the ER or at any of your settings, what would you advise, any healthcare professional or anyone really in the audience, what would you advise them to do to help, to offer help and maybe get the victim talking?
Sure. Well, at the most basic, hopefully all the healthcare professionals are able to offer that empathic, compassionate kind of interest. Before anything can happen, the patient has to know that the healthcare professional cares and has some ability to identify with what is going on. I don't know that much can be accomplished if they don't feel that trust and if they don't feel that compassion and empathy come across. Assuming that that's there, we train our healthcare professionals to at least know where to refer, even if their job is not to do an elaborate investigation. If they're an ER nurse, they're in no position to really explore the issue of what's going on at home, but they should know enough to know that, hey, I think you're telling me that you need some help and I really want to be available to help you. What I could do is I could make a call and get you an appointment with such and such. So, I would always advocate for and always hope that every healthcare professional connects to the patient with a sense of empathy, a sense of compassion, and offers some hope. Having done that, if the patient is willing to accept that referral, we know, of course, through the pandemic that it became very difficult for mental health professionals to have face-to-face meetings because there was such risk. Certainly last year, when we really didn't have a good understanding of the risk, everything just shut down. And the mental health world just flocked to the idea of telecontact. And we have done, I believe now, over 20,000 telecontacts in the past year, as all of our clinicians had to kind of ramp up. Our IT department had to help us ramp up to be able to offer HIPAA secure telecontacts with folks that need help. And that has been wonderful, not perfect. What we're finding, for example, is that many of the folks who are receiving help via tele are not in confidential, isolated spots. So it's very hard for them to pay attention. You've got kids running around in the background while the telly is on. You've got noise from the TV, or the window is open and trucks are passing by, or somebody's knocking on the door and the client, is going to have to excuse themselves to go see who's at the door. So tele has not been perfect. I think it will certainly last well beyond the pandemic, but we certainly need to iron out some of these issues and try to do what we can to make sure that if a client wants to participate in tele, they really have the focus, the privacy, and the ability, just as they would have in a face-to-face visit. So there is an enormous amount of resources that are available. Trinitas, for example, has a very large child outpatient department, a mobile outreach screening team, of course, our medical ER, our track team, our adult outpatient department. All of the staff are very well versed in identifying, assessing, and treating domestic violence. But it starts with that referral, and that referral really wouldn't happen unless the healthcare professional came across as truly compassionate, interested, empathic, and offering some hope.
Well, and from the medical side of it, so let's say, you're a nurse in like an ENT clinic, and I would say, and so maybe you don't have as much experience in situations of recognizing child abuse and neglect, of recognizing domestic violence. I would say, open up the questioning to focus on the family. How is the family doing? Because you may be able to identify some risk factors that is kind of like a train wreck waiting to happen. A person, a family situation that's heading for an intense crisis. And reach out to the skilled social workers and psychologists that are at your institution. And they can then relay some of the telephone numbers to organizations that can provide support, identify for them mental health practices in the community, places that they can then reach out to. So I think it's just a matter of opening up the questioning. I mean, it's like you said, it's not perfect. But open up that question. All right, you may be seeing grandpa for his hearing aids, but hey, ask grandpa's daughter-in-law, how are you doing? How are you coping? How are the kids coping? Expand the questioning to not just your patient, but to the patient's family, the psychodynamics that patient is going home to.
Excellent.
Identify whether that's an area where the potential for crisis exists.
Excellent. That's a great idea, Doctor.
Yes. So, is there, as we get closer to the end of this panel, and this is just a question I've been asking all of our panels, is there anything that gives you hope as we move forward, as the vaccinations are increasing? Anything at all that gives you hope about this current situation that we're in?
Well, for me, I think it's wonderful that we have, at least at this point, 3 vaccines, 3 different types of vaccines, that we do see people who are stepping up and they are willing. Trinitas, for example, has been delivering vaccines to the general public, 1,000, 1,200 a day at the Dunn Center at Elizabeth High School. So it's wonderful to see people who are recognizing the value of getting the vaccine. It does make me feel very hopeful that we will get to a point where we will see the vaccine, we will see the COVID virus, begin to diminish and begin to feel more comfortable about resuming normal activities. I mean, I'm very hopeful. Of course, listening to, the politicians and the doctors talking about maybe the summer, I hope it's the summer, but whenever it is, I do feel very hopeful that we can get back to normal, that schools can get opened again, that the school social workers will begin to get to know the kids again, and the kids will begin to get into that daily routine that is critical for their physical health and their mental health, as well as their academic learning. So I do feel very hopeful. I do think that people are motivated and willing to follow direction on social distancing, wearing masks, washing hands, Inside the hospital, we have no problem reminding people. They don't even need to be reminded. They're coming in with masks. They're washing their hands. They're asking for the sanitizer. So I do think that people are really falling in line and doing what needs to be done to get us beyond this pandemic.
I'm very hopeful, knowing that the response of the vaccines has been good, better than I think many doctors expected. And I also feel hopeful because of the statistics, knowing that there are victims out there who are still reaching out,
Yes.
who have not given up, who are trying to reach out to the best that they can, makes me want to reach out back, to say, don't give up. Try to tell as many people as you can, call as many numbers as you possibly can. You have a cell phone, call that 1-800 number and tell somebody about your abuse. Don't give up. We're here. We just need to connect with you somehow. So, and I think once things loosen up, we have to be ready for that connection, because we know that the floodgates will open. After research tells us after every disaster, we see a floodgate of all the trauma that happened during that isolation. So let's be ready for it, and let's never give up on them. They're not giving up. Let's never give up on them.
Yes. Well, that's time. Thank you both for your perspectives, for the statistics that you shared, for your time. And I think this will conclude the panel.
Well, thank you very much, Adela and Doctor. It was very nice to see you and meet you.
To meet you virtually and as well, Ms. C.A.R.E.S, and thank you for allowing me to participate in this.
For the Victim Impact Panel, the first panelist is Trish Perlmutter, who serves as the Policy Counsel at Partners for Women in Justice, an organization that provides free legal assistance to low-income domestic violence and sexual assault victims who are seeking restraining orders and related matters. She is the author of the 2020 report on the impact of COVID-19 on survivors of intimate partner violence in New Jersey, along with her co-author, Professor Jessica Miles. The report, The Impact of COVID-19, intensifies the shadow pandemic of domestic violence in New Jersey. It is available on the Partners website at www.pfwj.org, and it was also sent to all of you with the other program materials. The second panelist is Alejandra Londoño, who serves as the director of the PALS program, Peace, a Learned Solution at the YWCA Union County. The PALS program serves children ages 3 to 17 who have been exposed to domestic violence and the non-offending parent by utilizing creative arts therapies such as art, music, and drama. The PALS program serves on average over 50 children and 30 parents per year. So from the beginning of the pandemic, we theorized that COVID would unleash an epidemic of domestic violence. How does the preliminary data shed light on the impact of COVID on survivors?
I think I'll jump in here, and I think what we're seeing is confirming that COVID is contributing to a rise in intimate partner violence. And I don't think that we'll know the full story for another year. What we do know is that police callouts are up, especially in Elizabeth. In our COVID report, we gathered data for the first 3 quarters of 2020, and we saw that in Elizabeth, domestic violence calls were up 45% compared with 2019 numbers. Now, I would not say that those numbers are mirrored across the state. I think what we saw across the state was more of a 15 to 20% rise. There's a new national study out by the National Commission on COVID and Criminal Justice that estimates an 8.1% increase in domestic violence. But I also think we need to be cautious about only looking at police callouts as a measure of the increase in domestic violence, as we know that that's only one indicator and that most domestic violence goes unreported to the police.
And I can speak on the PALS program. We saw a higher number of victims requesting housing and food assistance. And during the pandemic, we were able to see that our undocumented clients were disproportionately affected because they did not qualify for unemployment benefits. And so they didn't have any of the financial assistance as backup to prepare for what was to come because they were unemployed. In addition, we saw that many of our undocumented clients who do not have access to health care, they were trying to prepare for the unknown and isolating themselves. And with this isolation came fear that if something were to happen to them, they were unsure what would happen to their children. So with the isolation and confinement and this fear of the unknown, we saw a lot of mental health crises and requests for assistance for resources for mental health services for not only the adults, but the children themselves. And throughout this year, we saw that many of the children who were not prepared ever to participate in distance learning have fallen behind. So because of the pandemic, many of our children are falling behind in school, and the IEPs and the 504 plans that they have been assigned were never created to be able to be implemented with distance learning. So right now we are trying our best in connecting these families, the children, to additional resources outside of school, because many schools do not have the resources or the funds or any of the services in place to provide for the children so that they can catch up with school.
So it's pretty evident that the pandemic really has affected survivors, their children, their families. How would you say that it has impacted their ability to access services, and in addition to court-ordered protections?
Well, I can speak on how the pandemic has impacted victims' access to services. In the beginning of the pandemic, we saw that many families were not used to accessing resources via the internet, right? And telehealth services. So it was a learning curve for not only staff, but for clients who don't have the knowledge of how to use this technology. And it came with, us teaching our clients to learn to navigate the system, which was a learning curve, and it took a little bit, but many of them caught on pretty quickly that this was the only way to access services, because not only us, but many programs throughout the state and the county were not offering in-person services.
I think what we're seeing is that technology is sort of double-edged, and that it has created barriers for many and eased barriers for some. And I think especially when you're talking about survivors who have limited English proficiency, limited access to computers or cell phones, discomfort with those, it's really a substantial obstacle. And I worry about, I think a lot of our clients showed incredible resilience and persistence in sort of finding a lot of workarounds, even just to reach out for help when their abusive partner was home. for such a long period of time, but I worry a lot about people who we didn't hear from that gave up or were frustrated. And I think the access issues have been really very, very challenging. And I think that there are two components to it. One is how we're sort of fracturing those human connections between the crisis response team being called out with the police calls and the court advocates getting to meet with clients at the courthouse. I think county by county, that there's a lot of variation a year into this, how much we have put the patchwork back together, but and it's time consuming, right? To go to the courthouse, to go to the FJC, all those things do take a lot of time. So there are some time savings here, but especially with technology becoming the access point for court. Your phone now is your courtroom. I worry about those who are self-represented on this docket, which is, the vast majority of clients, because not only do they have to, navigate the day of court, but they also have to make sure that their evidence is uploaded onto the judiciary's website now. They have to compress those files. There's a lot of wherewithal, and I'm sure you all are providing a lot of support for your clients in doing those things, as are we at Partners. But it can be discouraging, I think. And then we have, victims who are at home with their children and testifying about the father or maybe the mother of their children with children present, and that creates its own set of problems. We've had clients take their hearings from the car. It's very difficult. And then at the same time, the court is always looking to make credibility assessments. And there's so much going on in that Zoom hearing beyond the merits of the case. I think also just in terms of access to TROs, we had the first several months of the pandemic with the courthouse being closed for accessing TROs, so that the police was the only means of accessing the TROs. And I think that really met with mixed results. For some people, going to the police would be much more convenient and quick, but the police also were under dealing with multiple crises with COVID, and victims weren't allowed into the police station. Some victims were turned away, told to wait for many, many hours, and that became very discouraging for many victims as well.
So again, the pandemic really did add more complexities to the lives of the survivors. What adaptations would you say that, and I think you touched upon this a little bit, but what adaptations have the service providers had to meet to meet the needs of the survivors, while also, protecting the staff?
We had to make many adjustments within the program, but everything was geared towards trying to make the quickest and smoothest transition into providing services via the technology. So we implemented the telehealth services and use a platform that allows us to provide the services to the children and the non-offending parent via telehealth. And we, brainstormed and created art kits to curbside deliver to our families so that the therapist can have a session with the child with any directive that they please, because we have already delivered the supplies in order to facilitate this session. During the midst of the pandemic last year, we had many food deliveries that we went out to do to our families, because either Some of them were sick, or others, like I mentioned, were afraid to go out in fear that something would happen to them and no one would be available to take care of their children. So we delivered food, emergency supplies, even items to entertain the children, to try to keep their minds stimulated because of the isolation and the confinement. And then for staff, we provided the PPE to help them feel safe and, come into the office when needed to do their work. But primarily, a lot of the adjustments made were curbside delivery, where we would just drop it off in the front of their homes, and the telehealth services that facilitated therapy sessions, counseling sessions, and case management sessions.
Thank you.
At Partners, we quickly created a text line. We, got several Zoom professional licenses. We started using Zoom to meet with our clients. We spent a lot of time sort of working on, digitally preparing and presenting our cases, and then, helping our clients, with everything in terms of, preparing for participating for a trial on Teams or Zoom, helping with, just getting a signature, right? Getting signature software in order to make that possible for our clients. But I would also say, just in terms of the COVID report that Jessica Miles and I put together, kind of looking across the state, we were just both so impressed with the dedication of domestic violence organizations, the lead organizations in the state, including the YWCA Union County, because you all were on the front lines at a time of great crisis, and just the challenges of rethinking housing and shelter programs on the fly, the need to serve those clients and protect your staff. It's very, very difficult. And, meanwhile, I know folks from the coalition, the New Jersey Coalition to End Domestic Violence, were literally driving around the state trying to get toilet paper. It seems like a really long time ago that we were in that total unknown zone. But I think organizations really pivoted with incredible dedication. And yet at the same time, I think we have to acknowledge how hard it was for survivors to get services, and the Center on Economic Survivor Agency and Justice have done some surveys of domestic violence providers about their clients that have really highlighted the obstacles that victims have confronted during this year, whether it's getting enough food for their families, having safe access to work, getting unemployment benefits, access to lawyers, courts, information about the criminal justice system. We kind of have to hold, I think, these two images in our mind of the incredible dedication and work that has kind of produced some very good results, and yet kind of still not been able to diminish the real sense of hardship and fear and crisis in the lives of our clients.
Certainly. We touched upon technology a couple of times, and how it's been a little bit of a double-edged sword during this pandemic. How have you guys seen abusers utilize technology, for greater power and control over their victims?
So within the C.A.R.E.S program, we were able to see more reports of the abusers using technology to gain access inside the victim's home. And many of this was reports of the offending parent having access to the child's access to the child's camera while they're attending virtual distance learning, and them being able to see the child on the other end and the child being in the victim's home. We had reports of abusers controlling, the thermostats, the temperatures in the home, whether or not the internet was connected, whether or not even if the abuser who had access to the account was paying the account, right? And we also had many reports, more than typical, of abusers purchasing pieces of technology for children, whether that's an Apple Watch or a tablet or a computer, so that the child can carry it around with them, and the offending parent having access to the location of where the family was at all times.
What we saw, we see technology being used in a lot of our cases in an abusive manner. I think what's changed is just the amount of isolation and dependence that we all have on our devices right now. And, it's really our lifeline is our Wi-Fi and our phones. And so we did have a few cases where the perpetrator turned off the Wi-Fi or turned off the cell phone. And certainly to turn off the cell phone is a devastating situation. If the phone line is being paid for by the defendant, they have access to that phone number, and you can't, easily recover your phone and all your contacts. And so we've had to go into court and, ask for an order for the phone to be turned on. And there is actually a pending bill that addresses this type of abuse, which, we think is very much needed in general, but especially given COVID.
And also what we were able to see is that when this was happening with our clients and they were encouraged to report it, right? When they would report it, they felt like they weren't being heard, or the report was not being made, or they were informed that a TRO, they didn't have enough evidence or to prove for a TRO. So many of our victims were discouraged to continue reporting or documenting, because they didn't know how else to prove that this individual was manipulating devices or using these devices to have access to them and the children.
I think there's a disconnect sometimes in what the Domestic Violence Prevention Act requires, what the procedure manual requires, and then what a individual police officer might tell a particular victim. And there are, lots of officers who are doing incredible work out there, especially the domestic violence liaison officers. But then when someone wants to report a contempt, and they won't take that report and won't do anything about it, that has a real, systemic implications that flow from that is really problematic. And I'm sure you all have been in the same situation that we have at Partners, where we're advising our clients of, what steps they need to follow. And then they call back and they're like, but nothing happened. They refused, to take action.
Yeah, that has been our experience, unfortunately, with our clients, during this time. And we've had clients who are still waiting, for a follow-up on a restraining order being violated. And, so they do get discouraged from reporting if they're not being heard or action is not being taken.
Again, very challenging and multiplied by the pandemic. So, is there anything that gives you guys hope? The state is now, mobilizing to get as many individuals vaccinated. Is there anything that gives you guys hope beyond that point of maybe everyone or majority of the population being vaccinated?
Well, I'm hoping that there are going to be more resources and assistance for the children to, eventually try to catch up to where they should be, within their school grade, because it's going to have many ripple effects on the children and the family if this is not done. On the bright side, I'm hoping that now that we know that technology can be used to facilitate session and services, that, moving forward, we will be able to assist a larger range of clients, more clients than ever before.
I'm really excited about the child tax credit that's part of the stimulus bill. I think that sort of presents a vision of a guaranteed income for children, and sort of to help our clients really requires addressing extreme income inequality and structural racism in our state. And I think sort of there's a more robust recognition of the scope of the problems. In our recommendations to our report, we recommended, more resources for housing. I think kind of our state's lack of affordable housing is so inextricably linked to the problems of intimate partner violence and the problems survivors have in leaving those situations. And we also recommended more support for mental health services, that we need to recognize that the pandemic has such long-term consequences, and that the need is really great, that we need to kind of re-envision what the future looks like. And I think at the level of the courts, there's already kind of greater flexibility and new thinking, and maybe a model of court appearances that is not one size fits all would enable more people to participate in court when they need the assistance of the court with respect to their family issues. So I think it was a bewildering, deeply challenging, terribly frightening and devastating year, but that level of disruption doesn't come along very often, and does create some new opportunities.
Certainly. So, do you have anyone else have any last thoughts before we close? Well, I want to thank both of you for your perspectives. I think this was very enlightening, and thank you for all your work and your dedication to this population.
Thank you.
Thank you very much.
Thank you.
And with that, we conclude the 7th Annual Union County CARES Domestic Violence Symposium. On behalf of the YWCA of Union County, the Union County Prosecutor's Office, the Office of Victim Witness Advocacy, and the County of Union, I would like to thank you for joining us today. As a reminder to those receiving CEU credits for today's event, please make sure you take the survey that will pop up momentarily. As our panelists highlighted, COVID-19 has impacted many facets of victim services, but the pandemic has not impacted the tenacity through which service providers support victims. While the methods of connecting with survivors may have changed, our goal to support and seek justice for victims remains steadfast. Thank you.